All right, so I guess a little bit of background here. So and why this topic is really important. And as many of you may or may not know, I'm muting my phone because I get a lot of text messages, unfortunately. The disinvestment in public health programs through a succession of federal budget cuts have left our public health entities, as we like to say in Spanish, hacer de tripas corazones, which loosely translates to mending hearts out of guts. And so communities do their best with the limited resources that we have. And for me as an emergency physician who's been in the front lines of the pandemic since it started, I can attest that we worry about our capacity to continue on with our communities having high rates of infections, the setting of overcrowded hospitals. We worry about, the way that health has been politicized and people are refusing to wear masks, or refusing to keep physical distancing, refusing to take care of our neighbors. And so in the midst of that crisis and understanding the huge burden that this pandemic has had, particularly in minority communities and especially in the Latino community, a group of people from the community reached out and invited me to be a part of this first meeting of what then became the Illinois Unidos initiative. And so we are a consortium of, by now, there's over 150 members. It's a combination of elected and appointed officials. There's also a lot of health professionals, people like myself. There's also a few epidemiology and public health experts. There's nurses. There are pharmacists, representatives of community-based organizations. So a lot of community health centers like Esperanza Health Centers and Alivio, you probably know some of these names, but also cultural and political organizations. So like the Puerto Rican Agenda, Arise Chicago, which is a worker center. And we all came together to present one united front in stopping the growth of COVID in our communities. And this is actually just a picture of our website if you guys want to learn more about Illinois Unidos. Let me move to the next slide. And like I said, this was in response to what was becoming a growing problem in our communities. This is just to give you some national perspective of how the pandemic has affected populations differently. Hispanics and Blacks have had 3 to 4 times the hospitalization rates as our white neighbors, and 3 times the death rates of our white neighbors. And when you look at the city of Chicago specifically, when you do a hotspot of case analysis, you see that it's mostly these northwest and southwest side communities that have had some of the highest rates of infection when you consider the population in those communities, and also some of the highest rates of death. We could go to the next slide. So what did we start doing? So when we realized that early on in the pandemic, Latinos specifically were being left out of the narrative of the COVID crisis, we decided to work together to set up resources for our community, and a combination of informing the community about health resources, but also along with this pandemic, we are facing an economic crisis unlike anything that I've seen in my lifetime. And so we thought that it was very important that we provide resources related to housing, to food, to immigration resources, knowing that, again, our community has been hardest hit with loss of employment and what that means in terms of your survival. We can go to the next slide. In terms of health, we're not a health service organization per se, but we are an umbrella organization with people that are doing work in the communities in different areas. So whether it's community service organizations that help people find housing or food, but also a lot of health service organizations. And so that we've been working with people in the community to leverage our resources to increase access to testing, to increase access to early treatment for COVID, and likewise now increasing access to vaccinations. But one of the other things that we recognize is that there wasn't a lot of information that was reliable and that was easy to understand for our community. So this purely volunteer organization took all of the literature that's out there from the CDC and the WHO and a bunch of other websites, and we've curated these simple to read info sheets that are then widely distributed. We've created pamphlets for the community. We have them also up on our website. And so I urge you guys, if you ever want to have a conversation with your families about how to protect themselves from COVID and other topics, we have information on what to do with kids that get sick with COVID, how can pregnant women protect themselves, what can they expect to go when they go from the hospital. They're all in English and Spanish, and they all have these infographics that are easy to understand. And this we did in response to the fact that there was an absence of this easy to read, just reliable information regarding COVID for our community. You can go to the next one. And in addition, we've also we want to make sure that our communities continue to thrive in terms of their economy. And so there's some resources related to businesses for employees so that workers know their rights. Again, this is where other community service organizations like our workers centers have provided a lot of information on anti-retaliation legislation that's out there for people that may want to report employers that have not been keeping safe practices in the middle of the pandemic. And likewise, also just providing things for employees like proper personal protective equipment and space, adequate spacing so that people don't get sick, with again, the focus trying to increase prevention and also keeping our employees employed if they have to take time off. And just knowing their rights. If we can go to the next slide. So all of this we've accomplished through a list of priorities. The group grew from 30 people on that first meeting to over 150 people and multiple organizations throughout the city and the state. Some of the things that we focused on is improving data collection, again, recognizing that early on in the pandemic, Latinos were largely left out of the narrative of how people were being affected by this pandemic. So now we're making public health departments accountable for data collection, increasing testing sites, especially in communities with a high proportion of Latinos, examining what type of information people need, or examining forms so that people can get information, whether it's regarding testing or healthcare or resources outside of health, whether it means access to health insurance, access to financial help, access to again how to protect themselves and in their place of employment. We also wanted to increase access to people in the community of resources should they test positive. So whether that means a kit to protect themselves so that they can properly isolate in their space, or whether that means also, and that's not included here, but one of the other things that we did was looking at medical respites for people so that if they can't isolate properly at home and don't have the resources to keep themselves at home, that they would have then temporary housing so that they could isolate. And then also using just professional, bilingual, and bicultural personnel. We want to hold organizations that take care of our Latino patients accountable to ensure that they're communicating with people in a bilingual and culturally responsive way. We've also been very careful about developing plans to protect our undocumented workers and immigrants who often don't have access to a lot of the federal relief efforts and federal monies that have been assigned to municipalities. Plan, develop, and implement a bilingual educational campaign. Part of it has been these resources that we have on the website, but a lot of the work that we do is in town halls, in meetings, in discussions with our community members. And we have a lot of volunteers that are in the healthcare field who are ready and available and have given presentations along with some of our political leaders. In fact, that's why I had to cancel on you guys last week, because when Congressman Garcia asked, can you do a town hall with me? I say yes, because that's important. And then also looking at what resources have been invested in COVID-19 to identify gaps. And one of the things that we've looked at is specifically where resources are located. Are they being inclusive of some of the geographies that have been hardest hit by COVID, and also identifying again that they're adequate in their bilingual and bicultural personnel. And then and finally, working with Latino-based community organizations to accomplish all of these different priorities, and to continue identifying areas where we need to work to improve the health of our communities. And we've been pretty successful so far. If we could go to the next slide. This partnership has focused on these kind of 4 priority areas, which are data, policy, funding, and enhancing representation of Latinos. We've been able to, over time, if you see what the data reports look like at the city, county, and state level, compared to what they look like now, there's a lot more granular information related to where tests are occurring, the positivity rates, hospitalizations, and mortality by race, ethnicity, and zip code. In fact, because that data became more transparent over time is the reason why we're now seeing the city of Chicago taking an interest in investing in the communities that have been hardest hit with COVID through the Protect Chicago Plus program. The Chicago Department of Public Health also has made their data reports easy to navigate. So in fact, any of you can go to the Chicago data portal and look at maps to understand where our COVID infection rates are happening and mortality rates are happening. You can look by zip code. So it's a lot more interactive, and it helps inform communities where they need to invest efforts. Likewise, we've provided leadership to the data committee of the Illinois Department of Public Health Equity Task Force. In fact, myself and about 5 other members of Illinois Unidos are part of that task force and are informing the state as to how we need to slice, dice data and how we can react to that data. And with that, we're also proposing policies for data improvement, for more granularity, to understand how things like foreign-born status or language proficiency are affecting the health of our community. Through policies, we've been able to expand testing and now vaccine sites so that they're accessible to Latinos. We've identified vaccine ambassadors to message the Latino community in general, and specifically those hard to reach populations, such as the undocumented. And several of us have offered up our limited free time to speak to communities about the safety of the vaccine, how to get it, what to expect post-vaccines, and so on. We've also worked with federal, state, and local elected officials regularly. They attend our meetings and are actively partnering with us along with an array of experts so that we can continue infusing the policy process with accurate data related to COVID-19 and Latinos. With regards to funding, we've been successful at allocating funds aimed at supporting undocumented immigrants and mixed status families who were excluded from the federal stimulus dollars. In fact, our state of Illinois has been very progressive in that, and there is protection for mixed status families. There's health insurance coverage now for elderly undocumented people. And we've also been able to garner philanthropic financial support from member organizations to then focus on hyperlocal interventions to reduce transmission of COVID, and also to build a culturally appropriate and linguistically accessible COVID-19 literacy campaign. In fact, we've garnered over $500,000 for our member organizations for these efforts. And then, I think that one of the exciting things about all of this is, while the pandemic has identified what has exacerbated and exposed these huge disparities in healthcare, it's also provided an opportunity for improvement that I hope will last beyond the pandemic. One thing that we've been able to garner in this process is enhanced representation and decision-making roles within other advocacy groups, as well as philanthropic and government agencies. So many of us are members of the COVID Health Equity Task Force of the Illinois Department of Public Health. Several of us also sit in the Racial Equity Rapid Response Team of the City of Chicago, which is the group that is responsible for having developed the Protect Chicago Plus program. There's also many of us involved in the Chicagoland Vaccine Corps initiative. We have bi-monthly meetings on the books with the City of Chicago's mayors to continue having conversations about COVID-19 and other issues in the Latino community. And we've also been a lot in the media. Spanish and English language, local, national, and international media outlets have turned to Illinois Unidos membership for messaging, expert analysis, and any opinions related to COVID-19 data trends and policy proposals. So we've been very successful so far. We still have a lot of work to do, obviously. And I urge all of you, we're always looking for volunteers to help out with whether it means educating the community as the Protect Chicago Plus vaccine sites start opening. We're going to need people on the ground to help register folks, walk them through getting vaccines. And likewise, we're also always looking for tech savvy people to help us with our social media efforts and with creating, again, content for our communities. So if you could go to the next slide.
We have a question in the chat for you.
Sure.
How do you feel about how the City of Chicago has responded to the pandemic? Do you think that they are lacking somewhere?
So the City of Chicago is not perfect, but I will say that compared to other geographies in the United States, we have to give credit where credit is due. And although maybe a little bit slower to respond than what I would want, right? Seeing the crisis that has been happening in our communities, they have been responsive, albeit delayed. So an example is with data, for example. Early on, the city was reporting just as overall percentages who was dying without really providing more insight as to who was dying in that population and how that related to overall numbers in the city. And so what we've learned over time, the city's finally now being more transparent about this. And I shouldn't say finally, they've been doing this for several months, but they now report based on overall population. And that's where we've seen that there's been really a disproportionate number of deaths in the Latino community, similar to how that it's been in the Black community. So, you know, data, I wish they would have been looking at the data a little bit differently from the beginning of the pandemic, but eventually we got there. I think the other criticism that we could make to the city is in the midst of the Protect Chicago Plus program. This is actually an ongoing conversation that Illinois Unidos has with the mayor's office, as well as with the Chicago Department of Public Health. It seems to me a little arbitrary that they picked 15 communities out of the city to focus efforts on, to invest in vaccination efforts. When we know that the difference between the top 15 and the next 10 is not a lot. There are a lot of communities in Chicago that are hurting. And the way that those top 15 were selected didn't take into consideration some additional challenges that are faced in the Latino community. Example being foreign-born status, which is a measure that we can get to. You might not be able to tell how many people are undocumented in the community, but the census tract does give you information on how many people are foreign-born and what that means in terms of people's access to public health insurance. And the other thing is the language proficiency issue, which we've seen in other studies from other cities, such as LA, that have seen that there's a higher risk of mortality and a morbidity due to COVID when you are non-English speaking primarily. So those are measures that were not considered in determining risk. And I suspect that that's why there were some communities in the city that were left out of this initial Protect Chicago Plus program. We are currently working hard and advocating to add and make the list longer so that we can include communities such as Brighton Park and Hermosa that have been hard hit by COVID and yet haven't made it into that Protect Chicago Plus initiative. So, I think that what I would say is the city of Chicago has not been perfect, but at least they're having conversations with us. And that's better than what we've seen in other communities where, for example, you might have seen, I think it was out of Oklahoma, where they were saying that they weren't going to distribute vaccines to the undocumented. And they just flat out said that, right? Whereas in our state and in the city, they've been very clear that immigration status will not be a barrier for vaccination. So, we could do better, but we're working on it. So yes, please, as Natalia is saying, make sure you follow us. We also have a Twitter account if you guys do Twitter. We've talked about doing a TikTok account, but I'm not that cool. So I'm trying to get someone else to do that. So yeah, and we have a lot of good information. We try to post about, policy changes that are happening at the state, county, and city level. We work very closely with some of our senators and representatives, both at the state level and also at the federal level. So there's a lot of good information there. So yeah, please follow us. And if you get a chance to join one of our town halls, do so too.
Does anybody else have any other questions at all?
Come on, y'all. Now is your time to ask questions. We have Dr. Del Rios with us. This is a huge deal. So if you have any questions, any burning questions, ask them away right now.
Yeah, Dr. Del Rios, can you share more about your experience in being the first Chicagoan to receive the COVID-19 vaccine?
Oh, yeah. It was very much unexpected, but I took it with a great degree of responsibility. I think, again, going back to the fact that Blacks and Latinos have been very hard hit by this pandemic. I personally have lost friends or have had friends who have lost family members. And it's the reason why I've been very vocal with Illinois Unidos, with trying to advocate for resources for our community to stay healthy. And so, it was a great honor that the city of Chicago and the mayor and Commissioner Awadi selected me as one of those first 5 to be vaccinated in the city. And I followed through with the city, and I've made myself available to be what they call a vaccine ambassador, because I think that I believe that I can't ask my patients to do something that I wouldn't do. So in me getting the vaccine and being very public about that, I hope that will put more minds at ease regarding the safety of the vaccine and its efficacy. But at the moment, a lot of mixed thoughts. One, a relief in understanding that maybe there's an end to this, but also a lot of sadness in recognizing that we still have a ways to go. And, I think, again, there's still a lot of work to do. So.
Definitely. One of our coordinators asks, how do you manage your role as a physician and a community and public health leader? What motivates you to advocate for patients and their communities? And how do you persuade government officials and policymakers to respond to patient and community needs?
Yeah, so I recognize that I come from a position of a lot of privilege. I am at a point in my career where my clinical demands are less than when I first started as an emergency physician. And so I've always said to myself that when I have the opportunity, I will give back to my community. And so, what I would say to that is that I have a lot less free time than I think other people have by choice, because I'm passionate about the work that I'm doing. And what motivates me is just knowing that in maybe a small part, I'm making a difference. I've always said that, you guys should keep this in mind.
All right, Megan asks, when the city starts to heal itself from COVID-19 pandemic, what are some things you saw emerge during the pandemic that you hope will continue?
Well, so for one, I think this renewed focus on equity. I think that this infrastructure that's being built in Protect Chicago Plus in focusing resources in some of the hardest hit communities is something that can be easily translated to other diseases like diabetes and high blood pressure, kidney disease, heart disease. I think the other piece too is I'm hoping that that there are renewed policies to protect our essential workers so that our workplaces are safe and so people can live healthy lives. So things like paid time off for sickness, for example, providing health prevention and health resources in the workplace, whether that means, vaccine drives for influenza in the future or providing opportunities for active lifestyles in the workplace. I think likewise, there's been a renewed sense for understanding that we need to diversify our healthcare fields. And in fact, what we've seen, which has been one silver lining in all of this, is there's been an uptick in applicants to medical school who come from Black and Latino and Indigenous backgrounds. To me, that is comforting in seeing that there's a new generation of people of color that are interested in going into the health fields, that are interested specifically in going to medicine. And so what I'm hoping is that in this sense, we'll see more of a diversification of the healthcare fields, and with that, a renewed sense of equity and inclusivity in our practices, both from a healthcare standpoint and also just from a societal standpoint. But we'll see. It's hard to say how much of this will be long-term. I think it's up to us to continue advocating. And there's actually a saying that is out of Mikvah Challenge that I like a lot. It's called democracy is a verb. You can't just be comfortable with the idea that things will be okay because we live in a certain environment, but you always have to continue advocating throughout. So we'll see.
All right. Well, thank you.
Yeah, everyone, please type in the chat box or me, so please thank Dr. Del Rios for joining us today.